Good afternoon. I'm Lucy Aquino from Hispano Care, a program of Advocate, Illinois Masonic Hospital. And with me today is Dr. Yajnik. I do this to you all the time, Dr. Yajnik, from our Critical Cancer Center at Advocate, Illinois Masonic Hospital. So you're watching a live interactive call-in show. Please know that the lines are now open. At the bottom of your screen, you can call 312-738-1060 for any questions that you may have, either for myself or for Dr. Yajnik. Our topic today is breast cancer and cancer treatment prevention. We invite you again to call with your questions. Lines are now open. Dr. Yajnik, thank you so much for joining us again.
Thank you for having me on the program.
I know that recently we've had you out quite a few times because the topic of cancer is just not just so important, but there's just so much that's happening.
Yeah.
And of course, we've talked about prostate, we've talked about all other cancers, but today we're going to focus on breast cancer. Now, we know that breast cancer is a cancer that forms in the cells of the breast. Breast cancer can occur in both men and women, which is not something that's common, but it's far more common in women. And it's not clear what causes breast cancer, at least that's what I'm told, but doctors know that breast cancer occurs when some breast cells begin growing abnormally. So, breast cancer in the U.S. is extremely high. So how common is breast cancer in the U.S.? I mean, we talk about numbers being high, but how common is it really?
Unfortunately, breast cancer is very common in the United States. It's the most common cancer in women in the United States. It's a lot less common in men, about 100 times less common in men. But for American women, there's about a 1 in 9 lifetime risk of developing breast cancer, and the amount of annual cases of breast cancer is about 200,000 cases of breast cancer every year. So it's a very common cancer.
That's really huge, 1 in 9 in women. So let's talk a little bit about what are some of the risk factors in developing breast cancer.
Well, there are several risk factors that we know about, and some are obvious, such as being a woman as opposed to being a man. Breast cancer is a lot more common in women. Also, being an older woman is a risk factor for breast cancer because it tends to happen more commonly in older women than in younger women, although it can happen in younger women also. But there are also other risk factors that perhaps are less commonly known. For example, a minority of the women who are diagnosed with breast cancer actually have a genetic mutation, and we know of a couple of genes that predispose to a higher risk of having breast cancer and ovarian cancer. There are also some preventative causes of breast cancer that are risk factors. For example, obesity is a risk factor for breast cancer, and so a good diet and an active lifestyle can reduce risk of breast cancer.
I want to come back to a little bit. I mean, we talked a little some of the risk factors, and part of that risk factor, genetics play a part of that.
Yeah, and the two genes that I mentioned, BRCA1 and BRCA2, are what is called tumor suppressor genes. So when those genes are working normally, their function in the body is to reduce the incidence of tumors developing or cancers developing. But when you have a mutation in BRCA1 or BRCA2, then you are at increased risk of developing cancer. Now, most women who develop breast cancer do not have a mutation in BRCA1 or BRCA2. But there are some women, a minority of the women who develop breast cancer, who do have a genetic mutation, and they have what's called hereditary breast cancer. So.
Wow. I do want to remind our viewers that our topic today is breast cancer, and Dr. Yajnik from Advocate Illinois Masonic Hospital, Critical Cancer Center, and Hispano Care. We're here today to talk about this topic because it's so important, and we feel that this information, we cannot put enough of it out. So thank you for joining us this afternoon. Again, call in. The lines are open, 312-738-1060. Now, Dr. Yajnik, the breast cancer screenings that the American Society has guidelines for the breast cancer screenings. Can we talk a little bit about that?
Sure. And breast cancer is a cancer where there are some excellent screening guidelines, and screening definitely saves lives in terms of breast cancer by detecting cancer earlier when it is very treatable and very curable. So if you go to the American Cancer Society website, for example, at www.cancer.org, that is an excellent resource.
Right.
And the guidelines for the American Cancer Society, which are very well respected, would include an annual mammogram and an annual breast exam starting at the age of 40 for most women. Now, in your 20s and in your 30s, you would essentially have a breast exam every 2 or 3 years. And again, I would just say that there's the caveat that for some women who have genetic risk factors, those women may need to be screened even earlier.
So again, if you're predisposed to, and
Right,
it runs in the
right.
family, definitely your exams, your screenings should be much earlier.
Right, and I think that getting information about your family history, whether your genetic relatives have had breast cancer or ovarian cancer, can be very helpful if you then present that information to your general or primary care doctor. They can determine whether you fall in the subset of women that would benefit from perhaps being seen by a genetic counselor. We have a genetic counselor and a genetic screening program available at Advocate Illinois Masonic Medical Center and our Cancer Center, and many centers around the city do. And so I think that a good starting point would be to just discuss your own personal medical history as well as your family history with your primary care physician.
So doctor, can we go over some of the typical screenings and testings procedures that are usually done to diagnose breast cancer? What are some of those that are included?
The standard screening procedure for most women would be an annual exam and a mammogram starting at the age of 40. Now, there are some women that may benefit from MRI, but that is not a standard screening test for most women. For example, if you are known to have the BRCA1 or 2 mutation, then you may benefit from MRI as part of your screening. But when we're talking about the general population and general screening guidelines for the majority of women, women who are watching, I would say that annual breast exam and annual mammogram starting at the age of 40 would be where most women fall. And if you're someone who doesn't fall in that majority, you can discuss your specific needs with your primary doctor.
Now, sometimes biopsy is also part of that screening in the event it should. We talk a little bit about lumps.
So biopsy would sort of be the
How would
next
that be
step.
determined?
If a screening test were abnormal, for example, and sometimes I think it's helpful for our viewers if we just walk through what would happen if you had an abnormal screening test. So if you, for example, had an abnormal annual screening mammogram, typically you would then be called back for what's called diagnostic or magnification views, where they might do additional views with the mammogram, additional x-ray views to pinpoint whether there really is an abnormality or not. And then some women would then be referred for further testing with a biopsy, as you mentioned. A biopsy generally is used to establish a diagnosis of cancer. So it's oftentimes our first step if a test or an exam is indicating that there's an abnormality. During a biopsy, a tiny needle is typically put inside of a suspicious area of tissue, and then some cells or a tiny sample of tissue is extracted and then sent to a subspecialist called a pathologist, who would analyze those cells, look at those cells under a microscope, and tell you whether there's cancer in the sample or not.
And that's good to know. Most people hear biopsy, they don't know what it means, what it entails, and obviously, like anyone would be, they'll get frightened about what's going on and whether or not this is something you want, and you have all these questions. So it's really, really good to walk through all these steps and what's happening.
Right.
So doctor, how is breast cancer treated?
Well, the biopsy is used to establish the diagnosis of breast cancer, and once that diagnosis has been established, we would typically stage the breast cancer. So cancer specialists or oncologists typically stage cancers before we begin to treat them. And generally the staging process involves finding out whether it's spread to lymph nodes, whether it's spread anywhere or not, and doing a thorough physical examination. And for the majority of women, if it's a small tumor localized in the breast, the first step ends up being some sort of surgical intervention. Now, there are choices in breast cancer about how most women can be treated. And if we go back to the 1960s and 1970s, most women were having mastectomies. And oftentimes these were radical mastectomies where the entire breast was removed. This is going back to the 1960s and 1970s.
Right.
And oftentimes that would impact the quality of life of the woman who had the diagnosis of breast cancer. For example, if the muscle was removed under the breast, or if a nerve were cut during the surgical procedure, there could be deformities that would prevent her from having good quality of life. And so oncologists in the 1970s began to investigate whether it would be safe to do a lesser surgery for most women. These are women who present with generally smaller tumors that are amenable to a surgery called a lumpectomy, or a breast conservation surgery, where the tumor in the breast is removed and a rim of normal tissue around the tumor is removed, but the entire breast is not removed during the procedure. And following that, women receive radiation therapy. And what good studies have shown, for example, an excellent study that was started in the late 1970s has shown, is that for women with tumors that are less than 4 centimeters in size, if you have a lumpectomy followed by radiation therapy, that the overall survival from the breast cancer is equal to having a mastectomy. Now, that kind of a blanket statement doesn't apply to all women with breast cancer, because each cancer is different and each patient is different, and so the treatment should be customized to your specific cancer and your specific general medical health. However, there is a trend over the last 30 years of doing lesser surgeries and more of an emphasis on quality of life. There have, of course, been a lot of advances in breast cancer in every field, and the 3 main fields that currently treat breast cancer include surgery, radiation therapy, as well as medical oncology. Medical oncologists are physicians who subspecialize in using chemotherapy or hormone therapy for breast cancers. And in each of these 3 fields, there have been tremendous advances in not only treating the breast cancer more effectively, in a more targeted way, but also preserving the quality of life of the patient,
which is so important. And with today medicine changing as it has from the 70s to today, it's just changed so much.
Yes. Yeah.
It has.
Yeah.